Good morning, everyone. This is Tammy Costrini from Insurance Advisors Direct, and we are here today with Mark Thomas from Priority Health, and he will be going over the 2025 ACA plans for us for open enrollment. And thank you so much for joining. I know everybody is very, very busy with AEP, but this is also, OEP is right around the corner, so this is very important information for everybody to have. A little housekeeping. Everybody is on mute, so if you have any questions, please put them in the questions and answers, and I will monitor that during the presentation. And with no further ado, Mark, I will go ahead and let you get started.
Thank you, Tammy. Good morning, everyone. As Tammy said, thank you guys so much for taking the time out of your day to join us. Just so everybody knows, this was a 3-hour presentation that I did have condensed into hopefully what's going to be under an hour. I'm just going to kind of get to the most pertinent information. And just so everybody knows, as a spoiler alert, luckily there's not too many changes within the product portfolio. So without further ado, I'll go ahead and get started and start going over the 2025 open enrollment period regarding our individual and family health plans. To start off, I'll go ahead and give a brief overview regarding our sales team. Our sales team is comprised of 4 people, starting with Dwayne Judson as our sales manager, followed by Rhonda Burrell, who is our sales coordinator. Rhonda is somebody that we always have in the background. Whenever any of you have billing, claims, any sort of servicing issues whatsoever, I always have Rhonda in the background to assist with items like that whenever I'm out in the field working with agencies, facilitating training seminars, etc. I have Rhonda handling issues like that on the back end. That way we can try to be as responsive as possible for each and every one of you. We have Emily Martins, who is my counterpart in the north and west regions of the state. Whenever I'm out of office, I typically have Rhonda and Emily as my out of office. And last but not least, you have yours truly. My name's Mark Thomas. I am your individual sales consultant for under 65 ACA products related to Priority Health. I am your main point of contact. So if any of you ever have any questions, concerns, or comments that you'd like to make, please feel free to reach out to me directly. Try to be as responsive as possible. Sometimes when I'm emailed, it may take me sometimes a day or 2 to get back to you, especially during open enrollment. If something is time sensitive, I do urge you to just call me. If I miss you, leave me a voicemail. For those of you that know me, I am incredibly responsive. So please don't hesitate to give me a call if you ever need anything. And I'll make sure I either pick up the phone or get back to you as soon as possible. So to go ahead and get started, we'll go ahead and start by talking about our 2025 product offerings. So the non-standard plan limit, according to CMS, has been reduced from 4 to 2. Within our product portfolio, luckily, there's no real plan changes, with the exception of the fact for those of you that may have members in our pre-ACA plans. Those plans are going to sunset on December 31st of 2024. So for those of you that have members in the discontinued pre-ACA plans, they'll want to be your first priority. You'll want to touch those members to get them into a qualified health plan, whether on or off marketplace. So outside of those, none of the qualified health plans that we currently have within our product portfolio are going to be discontinued. The only real changes are some minor deductible and maximum out-of-pocket changes on some of our plans. We will now cover 30 chiropractic care visits per year, separate from the physical and occupational therapy, and that would include the maintenance visits. And lastly, the only addition we're going to have to our product portfolio is going to be the addition of a MyPriority Travel HSA off marketplace plan. And I'll get into that in a little bit more detail, but just to kind of give a quick summary and overview, this specific plan is going to be for a niche market. It's specifically meant to compete with PPOs. So for members that maybe are snowbirds, where they travel out of state for 6 months of the year, and they want to have coverage outside of emergency services, this is a great plan to point out to them. And it's very, very competitive as far as pricing. And it does work out of state because of our partnership with Cigna, which again, I'll touch on in more detail as we move forward. So some minor changes, our value bronze plan, which is our most popular bronze plan. Not only our most popular bronze plan, but probably one of the most popular plans and widely sold plans that we have in the state. The only change to this plan is the deductible and maximum out-of-pocket are actually going down. The deductible and maximum out-of-pocket will be reduced from $9,400 to $9,200. The standard bronze, which would also include the standard bronze travel, the maximum out-of-pocket for that plan will be reduced from $9,400 to $9,200. Within our silver plan offerings, the deductible on the MyPriority Balanced Silver will go down from $3,600 to $3,400, making a little bit more valuable to members, showing them what they're getting the most bang for their buck. And the Premier Silver, which is our most widely sold silver plan, the maximum out-of-pocket on that plan is going to go down from $9,400 to $9,200. So very competitive, and we're going to touch on that in a little bit more detail as we move forward. Our gold plans, not as widely sold throughout the state. In my personal opinion, it's better to put a member into a silver plan, and I'll elaborate on that a little bit more as we move forward. But the maximum out-of-pocket on the enhanced gold, which is a $0 deductible plan, the maximum out-of-pocket on that plan is going to drop from $9,400 to $9,200. And the standard gold is going to have a reduction on the maximum out-of-pocket from $8,700 down to $7,800. So these are just our product designs. We'll continue to offer the value bronze HSA, the value bronze, the standard bronze, as well as the standard bronze travel. Here's a quick screenshot of what the bronze plans would look like. So within the value bronze HSA, for members that are interested in those HSA plans, $7,200 deductible with a $7,200 out-of-pocket maximum. Everything else is only covered after the deductible and out-of-pocket maximum are met. This is going to be good for members that want to save on their premiums and take advantage of that HSA option. Next, we have the value bronze. Again, one of the most widely sold plans in the state. A $9,200 deductible with a $9,200 out-of-pocket maximum, but it offers quite a few first dollar copays, such as a $35 copay before deductible on primary care visits, a $120 copay before deductible on the specialist visits, $5 copay for tier 1A drugs, and $20 copay on tier 1B drugs, all before deductible. So again, very, very competitive. A lot of members want to see what they're getting before having to meet those high deductibles, and as well as helping them keep their premium down. So for a lot of members that are not quite worried about that high deductible and want to see what they're getting before meeting that deductible, definitely a great option. Next, we have our standard bronze and our standard bronze travel. For those of you that are unaware, standardized plans were something that were mandated by the CMS. So standardized plans, any carrier that participates on Marketplace is required to have standard plans. The only difference in these standard plans between every carrier is the premium, the size of the network, and the name of the carrier that's providing them. That's it. All of the deductibles, out-of-pocket maximums, and benefit offerings within those plans are identical across the board with each and every carrier. So standard bronze with Priority Health and every other carrier will have a deductible of $7,500 and an out-of-pocket maximum of $9,200 with the same benefit offerings as you see below. So PCPs at a $50 copay, specialist visits at a $100 copay, urgent care at a $75 copay, as well as the prescription drug benefits as you see below as well. The standard bronze travel, that plan is meant for members that want to have the option to utilize their coverage out of state. As you know, Priority Health is solely an HMO company. We offer an HMO plan across the board with no PPOs, but with our partnership with Cigna and Cigna operating as a nationwide carrier, we do have the option to partner with them and offer these travel plans, which means if somebody is traveling out of state for a long period of time and they want to have that coverage outside of emergency care, whether it's being able to see a specialist or whatever it may be, and having that option go towards their deductible and out-of-pocket maximum, very competitively priced. The only caveat to that is they do have to see a Cigna-based provider and facility. Outside of that, they are fully covered as in-network. Our silver plans will primarily remain the same. We'll continue to offer the Prime Silver HSA off marketplace. The only new plan for 2025 is going to be the Silver Travel HSA off marketplace, as I had mentioned earlier. Our Balanced Silver, which will be available both on and off marketplace, as well as the Premier Silver, also available on and off marketplace, as well as Standard Silver and Standard Silver's Travel. Now, you may be wondering, I thought all your plans are available on and off marketplace. That is correct. However, when you see the verbiage that says off marketplace, that means that's going to be specifically dedicated for members that are not going to qualify for those tax credits. When you see a plan that specifically says off marketplace, it's going to offer all the exact same plan offerings within that plan, all the same benefits. Only difference is, because it's stated as off marketplace, the premium on those off marketplace ones are going to be a little bit less than the ones that are available on and off marketplace. If it doesn't have the verbiage off marketplace, the premium has the potential to be a little bit higher. So again, more of a niche market. It's going to be more for those members that don't qualify for those tax credits. Here's a good breakdown of our silver plan offerings. Our Prime Silver HSA off marketplace. So again, another HSA option. This is going to have a little bit of a lower deductible of $3,300 and also a lower out-of-pocket maximum of $7,200. Most everything else within this plan is covered after the deductible has been met. Obviously covered at 100% after the out-of-pocket maximum has been reached. So this plan is going to be dedicated more for those members that want to be able to take advantage of that HSA offering. Next, our Silver Travel HSA off marketplace. So as I said before, this plan is specifically meant to compete with the PPO. So we'll use Blue Cross as an example. If Blue Cross's Silver PPO plan, they have both an in-network and out-of-network deductible. That does not happen with our Silver Travel HSA off marketplace. Everything is in-network as long as they see a Cigna provider when they're out of state. So let's use our $4,000 deductible and an $8,000 out-of-pocket maximum. If you're comparing this to, we'll say Blue Cross, let's say they offered the same exact PPO plan. In network, it'd be $4,000 for them, but out of network, their deductible would be $8,000. That out-of-pocket maximum, that would be $8,000 in network, would be $16,000 if they were out of network, because that's how a PPO works. With an HMO, there is no out of network. Everything is in network. Again, with a caveat, they do have to see a Cigna provider, which is very, very widely available throughout the country. So this plan is meant for that purpose, to compete with those PPOs for those members that travel out of state frequently. They want to be able to take advantage of the plan outside of emergency situations. And this plan is expected to be very, very competitively priced against that PPO option. Next, we have our MyPriority Balanced Silver, $3,400 deductible with a $9,000 out-of-pocket maximum. Quite a few first dollar copays here. And then we have our Premier Silver, our most widely sold silver plan throughout the state. We'll continue to offer a $5,500 deductible and a slight reduction in the out-of-pocket maximum, going down to $9,200. Now, this Premier Silver plan is the most widely sold plan in the state for a reason. Again, as I said earlier, a lot of members want to see what they're getting before deductible. This plan has a ton of first dollar copays. So PCP visits at a $30 copay before deductible. Specialist visits are a $65 copay before deductible. Now, that is specific to the broad network. As you know, Priority Health has a lot of narrow network options as well, which I'll delve into a little bit later. $60 for a copay before deductible on the narrow network options with Premier Silver. $75 copay on urgent care visits before deductible. And with the Premier Silver, it does cover up to tier 3 drugs as a first dollar copay before meeting the deductible. So tier 1A, $5 copay. Tier 1B, $20 copay, Tier 2, $75 copay, and up to Tier 3 at $125 copay, all before deductible. So a major selling point for that plan. Also, it is only a $10 copay before deductible on labs. So another major selling point for that Premier Silver. Then we have the standard silver, $5,000 deductible with an $8,000 out-of-pocket maximum, as well as all the benefits listed below, and the standard silver travel, $5,000 deductible with a $8,000 out-of-pocket maximum. And I'm going to send the agent guidebook, which is also readily available to each and every one of you via the agent center through the agent resource library. A very helpful benefit for you guys to have as reference. But again, with any questions you may have about this after the fact, feel free to reach out to me. But for the sake of saving time, I'm going to go ahead and move forward. So next, we'll talk about our enhanced gold and standard gold plans. I'm going to be totally honest with you guys. I don't recommend typically selling these gold plans, and I'll tell you why. The enhanced gold could look appealing because it has no deductible. Everything is offered at a first dollar copay without a deductible, but it does have a $9,200 out-of-pocket maximum. These gold plans are incredibly expensive, and they might seem appealing to a member that might not know the difference, but that's where you come in as the agent to guide them. The premium on these enhanced gold plans is astronomical. And if you're looking at a $9,200 out-of-pocket maximum and they're paying God knows how much on the premium, as an agent, you might want to point them in the direction of the Premier Silver. Yeah, it has a $5,500 deductible, but the out-of-pocket maximum is the same at $9,200, and just about most of the additional benefits within that Premier Silver are covered at a first dollar copay, just like the enhanced gold. The big difference is, how much are they going to save on the premium? Quite a bit. And on top of that, that Premier Silver, they'll have accessibility to the entirety of the broad network. What they don't tell you on these gold plans is these gold plans do have a bit of a restrictive network. Not every doctor and hospital are going to participate in these gold plans the way they will in our broad plans. So something to point out and something for you to be made aware of. When you're utilizing the Find a Doctor tool, if you have a member that is absolutely adamant about going on one of these gold plans, you're going to want to definitely utilize that Find a Doctor tool and make sure that that doctor accepts the gold plan. If it doesn't have the gold plan listed as one of the plans accepted, they don't take it. And that is a major point of contention where a lot of agents and members alike, we're not aware of that. And when the member goes to use their plan with a specific doctor, they can't. And they're under the impression, well, I'm paying so much money for this premium, I thought the gold is the best of the best. Not necessarily. So something to keep in mind. Next, the MyPriority Standard Gold, $1,500 deductible with a $7,800 out-of-pocket maximum. Again, a lot of first dollar copays. Covers all 5 tiers of the drugs at a first dollar copay. But I'd be curious to see what the rate is going to be. Also, off-marketplace rates are available in the 2025 rate book on the Agent Center. Renewal letters for existing members are expected to get sent out as of October 28th. So United States Postal Service will be sending out these renewal letters, and our operations team will hopefully have the tax credits, the updated tax credits involved with that for them. Next, we'll go ahead and talk about product positioning with our leading plans and the value that are brought to the members alike. So we'll talk about the strength of our HMO network. So Priority Health does offer members access to one of the largest individual HMO networks in Lower Michigan. We are not available in the Upper Peninsula. We are available in all counties in Lower Michigan. And we do include Sparrow Hospital as well as the University of Michigan. Now, with Priority Health, we do not require referrals to see specialists unless they want to see a University of Michigan specialist. That is the only situation where a primary care doctor will have to provide a referral to a member to take advantage of University of Michigan. So again, we do participate with U of M specialists and hospitals. Priority Health does not participate with U of M PCPs, unfortunately. But if you do have a member that does want to take advantage of U of M specialty care or take advantage of their hospitals, they can do that. They just need a referral to see a specialist with U of M. Also, U of M is not included in any of the narrow network options, so something to keep in mind. We will continue to offer 4 narrow network options that will be available on the bronze, silver, and gold options. So the 4 narrow network options will consist of the Bronson network, primarily within Southwest Michigan around the Kalamazoo area. We'll have the Corewell Health West option, again, available within like the Grand Rapids area. We'll have the Trinity Health Network. And then lastly, we'll have the Southeast Michigan narrow network, which is specific to Beaumont and Trinity specifically. Outside of those, no other networks are covered. So if you do have a member that wants to save money on being one of those narrow networks, that's great. You just want to advise them there is no coverage outside of those networks, period. But sometimes you might have people, let's say in Oakland County, I don't go to any other doctor or hospital outside of Beaumont. I'm perfectly fine being on a narrow network. Great. You can go ahead and write them on a Southeast Michigan plan, save them some money on their premium. And as long as they're perfectly familiar with the fact that they don't have the option to take advantage of University of Michigan, and they are restricted to Trinity and Beaumont specifically, that's definitely a great option to sell. So we do offer an out-of-area coverage option. So this is not something that's widely advertised, but I want you all to be made aware of this as well. And I did have our marketing team put something together on the Agent Center for your reference regarding our out-of-area coverage. What I'm referring to is something called an out-of-area dependent. So as an example, I was saying earlier that Priority Health is specifically an HMO carrier. So typically with an HMO, there is no out-of-state coverage because there is no out-of-network deductible or out-of-network out-of-pocket maximum. However, we also have that nationwide network Cigna that partners with Priority Health. So if you have 2 parents and a child is getting accepted to college, they're moving out of state, let's say they're going to go to UCLA. They don't want, they want to make sure their kid is covered outside of emergency situations. Let's say the kid has a concern, wants to go see a specialist. They can do that because of the partnership we have with Cigna. That child that's on that parent's plan can be listed as an out-of-area dependent. All that they have to do is provide customer service with Priority Health, proof that that child is attending college out of state. Usually the class schedule or proof that they're accepted into that college should be sufficient. And the child can take advantage of the plan that they're on. Let's say they're on a Premier Silver plan, tons of first dollar copays. Everything is covered as in-network within that plan for that child while they're out of state, as long as they're seeing a Cigna provider. We're the only carrier to offer this. So it is a huge selling point for members that you may have that are in that particular situation. So major selling point. However, if anybody's on the narrow network options, it is not applicable. This is only applicable to members on the broad network. So if somebody's on the Premier Silver, great. If they're on the Premier Silver Southeast Michigan or Premier Silver Bronson Network or Premier Silver Corewell Health West, that is not an option for them. Okay. So something to keep in mind. And again, a very excellent and major selling point to point out to those members that may have children attending school out of state. There's a lot going on in this slide. This is just showing all the different rating areas within Michigan. And there are 15 of them, which I'll touch on briefly as I go over our product positioning. We did have our actuaries go over certain areas that are very heavily populated, just to show how Priority Health aligns with a lot of the competition. So it's not a secret, Priority Health is having a rate increase of 18% this year. And while that does sound like a very high number, because it is, something to keep in mind is Priority Health has also been the most competitive carrier as far as a broad network goes within Michigan over the past couple of years. So even with that increase, Priority Health is expected to be very, very competitive. With that being said, we'll use a couple plan options to show you how they match up. So we'll start by going the plan positioning in the north side of the state. So we'll use rating area 14 as an example. Those counties include Grand Traverse, Antrim, Benzie, Charlevoix, around the Traverse City area, for example. So in this specific example, we're going to utilize the balanced silver. So on average, the balanced silver would be 4% less expensive in premium than our competitors. A low $3,400 deductible and a $70 copay before deductible for specialist visits. So major selling points, something to keep in mind of how these plans are going to stack up in certain parts of the state. Some parts of the state, they're going to seem higher than others. It is going to depend on a member's age, whether they're a smoker, and again, where they reside based off of their zip code. But Priority Health is expected to be very, very widely competitive based off of the examples I'm providing. And you'll be able to see for yourself. You're more than welcome to jump into Priority Quote to run some off-marketplace quotes. Unfortunately, tax credits are not applied yet since the second lowest silver medal plan has not been publicly released. So the tax credits are not mixed into those into the quotes, but at least for off-marketplace, you can kind of see how we're stacking up. Moving forward are the Value Bronze plan in rating area 14 in Northern Michigan. Our Value Bronze plan, on average, 3% less expensive than our competitors, a low $35 copay for primary care visits, and tier 1 drugs at a low $5 copay before deductible. So Value Bronze plan, very competitive and very, very widely sold, and should continue to be so in Northern Michigan as well. Now, if we move to the west side of the state around Kent, Lake, Mason counties, Muskegon, Oceana, etc., around the Grand Rapids area, we'll use one of the narrow network options as an example. The Value Bronze Corewell Health West option, on average 14% less expensive in premium than our main competitors, a low $35 copay for PCP visits, and low prescription copays on tiers 1A and 1B at $5 and $20 respectively. Also within the west side of the state, our Premier Silver plan, expected to be 3% less expensive in premium than our main competitors. Low $30 copay for PCP visits, $65 copay before deductible for specialist visits, and as I said earlier, a $10 lab copay before deductible. So a huge selling point to point out to those members that want to know that their labs are covered before deductible. You can let them know that they are within the Premier Silver plan. Now, as we move to East Michigan, Macomb and Oakland County, two of the densest and heavily populated counties within Michigan. They are looking at the Value Bronze plan as an example here. 6% less expensive in premium than our main competitors. And if somebody wants to go with the narrow network option, the Southeast Michigan plan, they can go to 8% less expensive in premium on the MyPriority Value Bronze Southeast Michigan narrow network plan, comparatively speaking to our main competitors. Again, a low $35 copay for the PCP visits and low drug coverage on tiers 1A and B at $5 and $20 respectively. Now, let's say within Southeast Michigan, somebody is potentially looking at a PPO plan. They say they travel frequently. They have a house in Florida. They're at 6 months of the year. They really only want to look at a PPO. Well, this is going to give the opportunity to present to them the Silver Travel HSA off marketplace plan, letting them know that Priority Health has a partnership with Cigna as a nationwide network, and you can save them tons of money on our travel plans that function as a PPO because of our partnership with Cigna. On average, 12% less expensive in premium than Blue Cross's PPO. A low $15 copay for PCP visits after deductible. Competitive specialist and urgent care copays after deductibles at $50 and $70 respectively. And pretty rich RX benefits at tier 1A drugs at a low $5 copay after deductible. And again, this is an HSA option as well. So not only can they utilize the plan out of state at in-network options where all the money they spent goes towards their deductible and out-of-pocket maximum, as long as they see a Cigna provider, it also has that HSA mechanism in there as well. So something to point out to them and a major selling point, not to mention the cost savings that it's going to allow a prospective member on their premium.
Mark, I have a question on that,
Sure.
going back. So I think it's really important for agents to think on this one, like you said, because we have so many consumers who are 62 or 63 and their spouse who held the health coverage is now on Medicare. So they're going on an ACA plan, and so many of them are snowbirds. So I think we don't think about ACA and the Medicare connection with Florida and snowbirds. So I just want to really hammer that one home, the importance of it. But when they are, say they're going, for 6 months, they can use the Cigna network on their medical, but what about the prescriptions?
Same thing.
Same thing. So they
Same
would
thing.
use just like a Walgreens, a CVS, whatever the case may be, right?
Absolutely. Absolutely. All the benefits available within this plan that would normally be available within the state of Michigan can work out of state. Absolutely. As long as they see a Cigna, a doctor, facility, pharmacy that participates with Cigna when they're out of state, they're covered just as they would be in network. And that's an excellent selling point. A lot of agents at Insurance Advisors Direct do concentrate more so on Medicare than they do individual. So when you do come to this particular situation where you do have members in their 60s, and as we know, members in their 60s are highly rated. So their premiums are going to be substantially more based off of their age. So writing a member that's 62 or 63 or 64 on a PPO plan would be astronomical compared to our Silver Travel HSA plan. And again, assuming they're pretty good with money, you can point out that HSA option for them as well. So, but yeah, that's a very good point. I'm glad you brought that up. Thank you. Now we'll talk about some additional reminders. So this comes from the operations side of the company. So they're saying that agents shouldn't make requests for changes to the effective date after you submitted the application, obviously for off marketplace. I'm going to be honest with you. Yeah, that's what they're saying. I am here to support you. Okay. So if you guys ever have a typo in the application and it's off marketplace, please let me know, and I'll be able to reach out to them and guide you and direct you appropriately. Whether it's, hey, the application is still pending, we'll have them remove it. We'll have you resubmit it with the proper effective date. No big deal. The application already went through. I'll reach out to operations and we'll ask them to make an exception to make that change. So although that's what they're saying, I am here to support you and advocate for you. So don't let that get you down. However, if they are on marketplace, anything related to on marketplace, I hate to say it, but there is little to nothing I can do to assist. When it's on marketplace, you do have to deal with the marketplace directly. So if you have members enrolled in an on marketplace plan, any changes made, whether it's an address change, date of birth, effective date, etc., all of that has to go directly through the marketplace, because Priority Health will take their guidance from the file they receive from the marketplace. As far as terminations, operations is saying agents should not request retro terminations, and Priority Health does follow the CMS guidelines that will terminate the date of the request or a future date. Again, when it's off marketplace, I am here to assist you. Although that's what they're saying, I will always back you up whenever you need it. Dental plans, no changes in dental. We will continue our partnership with Delta Dental as we have in the past, with absolutely no changes. Preventive services are covered at 100% immediately with no waiting period. Major dental services like Class 2 services, which is our, fillings, things of that nature, those are covered after a 6-month waiting period. And Class 3 services like bridges, dentures, endodontic implants, things of that nature, those are covered after a 1-year waiting period. Usually the waiting periods can be waived if a member has proof of prior coverage showing that they were previously enrolled in a dental plan for a minimum of 6 months prior. And you can send that over to our operations team at MyPriority@priorityhealth.com, that they will get over to their contact in Delta Dental, and they can work on getting those waiting periods waived for you. As a reminder, they don't get a separate Delta Dental card. They do see a separate line item on their invoice for the supplemental dental premium, but they don't get a separate dental card. If they want to use the dental, they can primarily provide their Priority Health ID, just provide that card. But I would also encourage you to let your members know that they can download the Delta Dental app on their phone, and it gives all the information. I have it personally, and it works out really well. Also, something else to know. If somebody goes to the Delta Dental website, they have a variety of different networks. With Priority Health, we only use the Delta Dental broad network. So if you do the Find a Doctor tool and a dentist says that they accept Delta Dental, the member's covered. It doesn't matter what network it is because they got it through Priority Health. Priority Health's partnership with Delta Dental is only applicable to the full network. There is no narrow network option with this. So something for you to know, because it can get confusing if you go to the Delta Dental website where they have a variety of different networks. So something to keep in mind when doing it with Priority Health directly, they only use the broad network. Our vision plans will remain identical as well. We'll continue our partnership with 𝗍𝗵𝗲. Exams, lenses or contact lenses and frames are allowed once every 12 months. The participating vision providers are all available in the Find a Doctor tool, and the plans are based on a 12-month contract. That same thing is based on also with Delta Dental as well. So when they're in these plans, they are on them for the full year. If they want to drop off of the vision plan, you'd have to terminate the entire medical as well. That's not the same with dental anymore, but it is the same for vision. So they can't just cancel vision in the middle of the year. They're on it for the entirety of the year. Also, they can't enroll in dental or vision outside of open enrollment or a special enrollment period. Okay, we don't offer year-round dental or year-round vision. So something else to keep in mind. And we will go ahead and wrap things up by going over our rates and commissions. So no new changes to our commissions. Our street level commissions will be 5% for new to priority members. So any members that you write for new to priority will result in a 5% commission. Renewing contracts will continue to be 4%. So any contracts that you wrote with an effective date of January 1st of 2019 and later, the residuals on those will be 4%. And renewing contracts that had an effective date of December 1st of 2018 and before will only be paid 2%. Something tells me that'll probably be going away with a discontinuation of those pre-ACA plans, which is what this is primarily geared towards. Short-term contracts will continue to pay 20%. There wasn't touched on this in the slideshow. I'll briefly go over it. For those of you that aren't aware, the short-term plans do not go for 6 months anymore. The length is up to 4 months, period. So that is the longest a member can be on a short-term contract, and it is 4 months. And after they've exhausted that 4 months, let's say they finish their short-term contract on November 1st of 2024, they can't come back to a Priority Health short-term contract until November 1st of 2025. So they do require a 1-year gap from the end of that short-term contract. As far as the commission goes, it is at 20%, and dental and vision alike will continue to pay 2% on both new and renewing contracts. So 2% for new and renewing contracts for dental and vision. Something else that's not in this slideshow that if you haven't received the email, you should be getting it soon. There is going to be a very lucrative bonus program in place for both new and retention. So I'll quickly go over that for those of you that are listening. They are estimating a $100 bonus per new contract written during open enrollment, which is estimated to run from November 1st of 2024 to January 15th of 2025. Okay. So that would allow any new contracts that you write during open enrollment specifically. SEPs are not applicable. New contracts written for Priority Health during open enrollment, they're estimating a $100 bonus per contract plus the 5% commission. So that can make it a very lucrative open enrollment for new members that you're taking on with Priority Health. for those of you that might have a decent block of business with Priority Health, if you have members that are saying, you know, I see that, you know, it's $10 cheaper for me to go to Blue Cross, or, you know, it's $30 cheaper for me to go to AM Better. So they're going to offer a $25 retention bonus not to switch them per contract during this open enrollment, plus the 4% retention for the renewing contracts that you would receive. Plus, not to mention, Priority Health has always been known to have excellent customer service, as well as a very broad network. So to kind of counter that, you can also let them know about that, as well as the broad network options made available to them. So something to point out there, something for you guys to be made aware of. You're obviously going to do what's going to be in the best interest of your member, but you're not here to work for free either. So Priority Health, as a thank you for your loyalty to Priority Health, is going to be offering these bonus programs to you. And you can see the rates and commissions for the 2025 rates and commissions are all going to be available in the Agent Center. If you have any questions about navigating through the Agent Center, please don't hesitate to reach out to me. For those of you that know me pretty well, I don't hesitate to make one-on-one visits. So if you'd like me to come by and spend a half an hour to 45 minutes or even an hour of my time with you to make you more familiar with the Agent Center, the Agent Resource Library, or just dedicate that time to get you a little bit more familiar, I am here for you. So feel free to reach out. But again, you can simply download and print out the individual rating areas for easy access by using the searchable interactive rate book. And again, this is all available in the Agent Center, and rates are available in Priority Quote. And as we wrap up, this is the final slide. For those of you that both sell on and off marketplace, which I would assume you do, please make sure you've renewed your FFM certification to sell on marketplace. You can go to portal.cms.gov. You can even do it through 𝗿𝗵𝗆. Please make sure if you're selling on marketplace, you have renewed your FFM certification. If you haven't and you sell for a member on marketplace, you will not be paid. They will not retroactively go back and pay you after you get certified. So please, please, please make sure you've completed your FFM certification. That way you're compensated fairly for your work. With that being said, I'd like to thank you all for taking the time out of your day, and I would be happy to answer any questions anybody may have.
I don't see any questions, but we'll wait for them to, we'll give them a minute to see if they add any in. But just to your last point, I want to reiterate too, that if you have not completed your recertification for FFM, I believe tomorrow is the cutoff date for them. So if it's like 5 questions, I think, for the recertification, takes about 30-45 minutes, super simple, free, nowhere near as complicated as AHIP for our Medicare agents. And if you do not complete it in time, they will, like he said, you will not be able to sell on the marketplace. You also will not get your renewals for any business you have already done in the past. So super, super important that you make sure to get recertified.
And Mike, to answer your question, I'm sorry to chime in, Tammy, I apologize.
You're fine, you're fine.
Can we get a list of hospitals for Balanced and Premier networks? Yes, you can. Again, that is available in the Agent Center. And I will tell you what, I'll actually do you one better, Mike. I will be more than happy to send you that list directly. That way you will have that full breakdown of, if you want to go ahead and, actually you can go ahead and send me your email. I think I should have it in here for you, but yeah, I'll be more than happy to send that over to you. That way you know exactly what doctors and hospitals are, or excuse me, what hospitals are covered within what networks. So I've got a very good breakdown on that for you. And I guess we'll give it a couple more minutes and see if we have any additional questions.
We don't, but again, the Agent Center is a wealth of information for you. I encourage all agents to, if you haven't been out there in a while, to go out there and take a look at everything. Lots of resources. I know we're often working late into the night and on the weekends. So that is going to be a lifeline for you as we go through OEP and the off hours, so to speak, but they do have great service as well. And You can always reach out to me. If I don't know the answer, I will reach out to Mark and get it for you, or Emily, if you're in the north and west sides. I don't see any other questions that have popped up, so I don't want to hold anybody. But again, just reach out to us if you do come up with questions. And as we get started into OEP, we are here to help you in any way that we can. And thank you again, everyone, for joining today. We appreciate your time. And thank you, Mark, for taking your time out.
My
to
pleasure.
help the
And
agents.
also, Mike, just so you know, before I get off this call, I will be sending you this email literally right now. So that being
Fantastic.
said, I hope everybody has a great rest of your day, and thank you for taking the time.
Thanks again, everyone. Take care.
Bye-bye.